Clinical trials are really important. They are essential for testing and developing new treatments that advance outcomes and improve survival for people who have cancer. It's really important that when we have a new treatment that we're able to test it against the standard of care, meaning the treatment that is most generally used for that certain situation. And it's important to do it in a clinical trial so that we can use scientific methods to make sure that a new treatment is better than what we have, or to prove that the treatment that we already have remains the best treatment. When you're first diagnosed as a patient, sometimes the topic of clinical trials doesn't come up. And part of that is because there are not a lot of trials for people who are newly diagnosed, because we have very good first standard of care treatments. Now, that being said, there are some clinical trials that are appropriate for people who are newly diagnosed, but there are far fewer than for people who have relapsed disease. And so that might be one reason. The other reason is time constraints. The reality of medicine is that, during our visits with you, there is so much to cover. There is, the discussion of the diagnosis, the potential treatment options, and unfortunately, clinical trials sometimes don't come up. And we're working really hard to change that. There are many different types of clinical trials, and I think that is important to keep in mind, especially if you're approached to join a clinical trial. So when people think of clinical trials, the most common trial they think about is a treatment trial. And a treatment trial is where we're comparing the standard of care treatment with a newer treatment to see if a new treatment is better than our best standard of care treatment. But there are a lot of other clinical trials. So you could be getting standard of care treatment and still be on a clinical trial that maybe interviews you about your quality of life. Or maybe there is a clinical trial that's testing supportive care and looking at symptom management. Or maybe there's a clinical trial where you don't even have to do anything, but the researcher wants to use your medical information in aggregate. Like, for example, they might want to know how well do all people who have Hodgkin lymphoma who are between 20 and 30 years old do with ABVD, and they just want to use your medical information. So anytime that we do research that involves human beings, it requires informed consent. And if your approach for a clinical trial might not necessarily be for a treatment trial, but all of these other trials are really important because it helps advance our understanding of how best to take care of you holistically. As a patient, if you're interested in increasing the number of clinical trials or access to clinical trials, I think that it is helpful to be part of a patient advocacy group and work through different professional organizations. Developing clinical trials is a very complex undertaking, and requires collaboration in the clinical trial center, and often across the country between clinical trial centers. So a lot of clinical trials are either funded by pharmaceutical companies, or they're funded by collaborative groups, which are groups of cancer centers which work together to put together clinical trials. But the professional organizations do a lot of advocacy, and some of that advocacy is directed towards developing additional clinical trials. And in fact, some of the professional organizations offer grants to researchers to support funding for them to conduct certain clinical trials.